I'm Nancy Vish, President and Chief Nursing Officer at Baylor Jack and Jane Hamilton Heart and Vascular Hospital. I want to personally thank you for choosing Baylor Heart and Vascular Hospital as your treatment center. Now that you're ready to be discharged, it's natural to have questions about what comes next. The Take the Journey video you're watching and the Take the Journey booklet are great tools for helping you find the answers to questions you, your family, and support group may have. Maybe some questions you haven't thought of. We've provided guidelines to follow and healthy living tips so that you can make the transition from hospital to home comfortably, safely, and with confidence, and with the knowledge to make healthy choices. Remember that discharge from the hospital is just the first step toward a healthier future. Your continued progress is your responsibility. With the support of your family, support group, and the Baylor Heart and Vascular Hospital team, your informed choices can help you achieve a new, healthier beginning. Please take a few minutes to relax and watch this video. Baylor Heart and Vascular Hospital is here to help you on your journey to heart and vascular wellness.
Good morning.
Good morning.
I hear you're ready to go home today.
Words you've been waiting to hear, no doubt. At the same time, you've just undergone a medical procedure and may be a little uncomfortable about leaving the safety of the hospital. That's to be expected. It's all part of your journey to recovery. And this stage of the journey is where you take charge and take care of your health, not just for a couple of weeks or a couple of months. Your commitment to wellness is for a lifetime. That's why when you leave the Baylor Heart and Vascular Hospital, you take home a little more than you brought.
Taking charge of your recovery is a big job, and we want to give you the best tools for it, especially knowledge. When it comes to your health, knowledge really is power.
We're sending powerful knowledge home with you in the form of the Take the Journey video you're now watching and the Take the Journey Achieve Heart and Vascular Wellness booklet. It's packed with all kinds of easy-to-read information. You're also taking home a medication reconciliation form, a Know Your Numbers card for your wallet, your prescriptions, and discharge instructions with information specific to your procedure and your recovery. You may receive more than one, depending on the procedures that were done. Taking a closer look at the discharge instructions form, you'll see your physician's phone number right up at the top, along with when he or she wants to see you next. We encourage you to make your follow-up appointment before you leave the hospital. If more lab work is recommended, you'll find that information too. If you have an incision, you'll find instructions for how to take care of the surgical site, including how to keep it clean and how to be sure it's healing properly. Other sections tell you when to call your physician, when to begin certain activities, and what to do for pain. Now, let's look at the medication reconciliation form. It lists all the medications you were taking before you were admitted to the hospital, and this is very important. It tells you whether to continue or to stop taking them. For those medications you are to continue taking, there's even a box that shows you when to take the next dose. On the bottom half of the form, there's also a list of your new medications, how to take them, and how often.
Make sure you don't stop taking any of your prescribed medications because of cost or inconvenience. Always discuss with your healthcare team any difficulties or challenges you may have in taking your prescribed medications. There may be some options for assisting you with these issues. Please be aware that medications are just as important as the procedure to keep you on your journey to wellness. Discontinuing certain medications may lead to readmittance to the hospital or lead to complications.
Meanwhile, keep your medication reconciliation form handy and take it with you to your next physician's appointment. And finally, you'll be taking home this, the Know Your Numbers wallet card. On one side, there's a place for you to fill in all the medications you're taking. You can copy them straight from your medication reconciliation form, including the dosages and frequency.
How many times are you at the physician's office or the pharmacy and they ask you what medications you're taking? Now you'll have that information up to date and right in your purse or your wallet. It's also a good idea to use the same pharmacy for all your prescriptions. That way, the pharmacist is aware of everything you're taking and can check for any potential drug interactions.
As we said, one of your most important tools is knowledge. So here's a quick refresher course on cardiovascular disease. Cardio refers to the heart, vascular to blood vessels. The heart is a muscle that pumps blood throughout the body. Like all muscles, the heart needs oxygen to function. Blood carries the oxygen to the heart through blood vessels called arteries. That is, until plaque, a combination of fat, cholesterol, and other material, builds up inside the arteries, hardening and clogging them. When plaque builds up in the coronary arteries, the arteries that supply blood and oxygen to the heart, it can cause chest pain, also known as angina. Angina is serious, but doesn't cause permanent damage. However, if the plaque completely blocks one or more coronary arteries, a heart attack results. Heart attacks permanently damage the heart and can be fatal. In the case of angina, chest pains usually go away with rest. Do not last more than 20 minutes. Occur with physical exertion or excitement. Pains that may signal a heart attack do not go away with rest. Last more than 20 minutes. May occur without activity or excitement. Arteries to the brain can be blocked. When this happens, part of the brain can't get oxygen and is damaged, causing a stroke. Stroke can result in speech and memory problems, paralysis, and even death. If the arteries in the leg are clogged with plaque, you may have cramping or aching in your thighs, calves, or buttocks when you walk. This is known as peripheral artery disease, or PAD. The symptoms of a heart attack in women are sometimes different than those in men. For instance, women are more likely to have pain in areas other than the chest, such as the throat, neck, back, or jaw. Women are also more likely to experience shortness of breath, nausea and vomiting, and fatigue. Remember, heart disease is not just a man's disease. More than twice as many women die from cardiovascular disease than from all types of cancer. The good news is we can all help avoid these conditions by reducing certain risk factors known to cause cardiovascular disease or make it worse. And now that you have had your procedure, you of course want to do all you can to get back to a full, active life. There are two kinds of risk factors, uncontrollable and controllable. The risk factors you have no control over are age, gender, and family history. But there are many more risk factors you can control, such as high cholesterol, high blood pressure, or hypertension in medical terms, smoking, physical inactivity, being overweight, and diabetes. And the place to start controlling these factors is with your Know Your Numbers card, where you listed your medications. On the other side is a place to keep track of your vital numbers. Blood pressure. Your blood pressure should be less than 120/80. Total cholesterol should be under 200. HDL, or good cholesterol, over 40 for men and over 50 for women. LDL, or bad cholesterol, below 100. And for triglycerides, which is a type of fat in the blood, the goal is under 150. Other factors to keep track of are your fasting glucose, which is the glucose level after a person has not eaten for 8 to 12 hours. Hemoglobin A1C, a test that shows the average glucose level for the past 3 months. Your body mass index, or BMI, and your weight. Each of these, when too high, can put you at risk for heart disease, stroke, and other serious health problems. The exception is HDL, or good cholesterol, the one number you want to see go up. As you get new numbers, write them down. Put down the date, too, so you can chart your progress. Then, compare your numbers to those in the goal column. How do you get your numbers? Talk to your physician about how often you should get your blood pressure checked. It all depends on your unique medical history. You may have your blood pressure checked by your physician or at a grocery store with a self-checking blood pressure machine. You can also check it with an in-home blood pressure monitor. Ask your physician what blood pressure numbers are healthy for you. A successful recovery is closely linked to controlling your blood pressure. As for cholesterol, have it checked at your physician's office, a pharmacy, or other locations. Checking your cholesterol after starting a new medication or making lifestyle changes will help you to know if you're on track. A simple blood test does it. Follow up with your physician to find out when you need to get your cholesterol checked. If you're taking medication to lower your cholesterol, it's important to keep taking it, even if your numbers start to improve. Diabetes, if not managed well, can be another contributor to heart disease. We've included a chapter on diabetes later in the video. But even if you don't have diabetes, you need to know your fasting glucose level. It can help diagnose diabetes. The goal is less than 100.
Hi there.
Hi.
Hello this is your book. This is your body mass index chart.
A body mass index measures your weight in relation to your height and is a good indicator of total body fat. Calculate your BMI using the chart provided in your Take the Journey booklet. If your BMI is 25 or above, it is recommended that you lose weight. Another good measurement to take, your waist. Women with a waist measurement of more than 35 inches and men with a waist of more than 40 inches may have a higher risk of health problems than people with smaller waists. In fact, abdominal obesity is one of the factors most commonly associated with metabolic syndrome, sometimes called insulin resistance syndrome. It's on the rise in this country, and people who have it have a higher risk of heart disease, stroke, and type 2 diabetes. A person is diagnosed with metabolic syndrome if they have at least 3 of the following conditions: abdominal obesity, as we mentioned, high triglycerides, low HDL, elevated blood pressure, a fasting glucose level above 100 milligrams. Metabolic syndrome is very treatable. Remember your controllable risk factors? You are, in effect, taking control of them every time you make a lifestyle change that puts you closer to your goal numbers. These changes are not short-term.
These changes are for life, a better, longer life. Some changes will be challenging. Be patient with yourself. Encourage family and friends to support you, and when you slip up, just know you'll do better next time.
One of the biggest lifestyle changes you can make is what you eat. Nutrition is key to controlling cholesterol, triglycerides, fasting glucose, and hemoglobin A1C, BMI, and your weight. It's time to make healthier choices.
Try not to think of it as a diet. Instead, see it as a healthy change, with you in charge, making smart and still good-tasting choices.
Learning how to read food labels is another way to take charge of your life. Pay attention to the saturated fat and cholesterol in foods. Stay away from foods that tell your liver to make more cholesterol. Foods like fatty meats, fried foods, and even whole milk dairy products. Instead, choose more fish, white meat poultry, lean red meats, tofu, beans, and non-fat milk. Just look at the differences between whole milk and non-fat milk. An 8-ounce glass of whole milk has 150 calories and 5 grams of saturated fat. That same 8-ounce glass of fat-free milk has 90 calories and no fat. More fiber can help lower your cholesterol. Try to eat about 25 grams each day. Many fruits and vegetables are naturally high in fiber. So are whole grains and nuts. Get more heart-protecting omega-3s in your diet by eating salmon and adding flax seeds and walnuts to your food. Healthy fats are fine, including olive oil, canola oil, peanut oil, nuts, and avocados. Cut back on the salt, though. Too much sodium, more than 2,300 milligrams a day, raises your blood pressure. Limit most canned products, lunch meats, soy sauce, and packaged foods. Many are high in sodium. Try using more herbs, spices, and other salt-free seasonings to flavor your food. Cut back the added sugar, too. Way back. A diet high in sugar can increase your triglyceride levels, make you gain weight, and, if you have diabetes, raise your blood sugar levels. Use alternative sweeteners. Choose fresh fruit to snack on instead of candy. When you just have to have dessert, eat a small portion. 3 to 5 bites can satisfy a sweet tooth. And just say no to sugary sodas. Did you know a regular 12-ounce soft drink has about 8 teaspoons of added sugar? Drink club soda or mineral water flavored with lemon instead.
You can change your eating habits without feeling too deprived. The food guide shows us that all foods can fit into a healthy eating pattern. The key is balance, variety, and smaller portions. You can have a positive impact on those controllable risk factors for heart disease simply by changing the foods you eat.
Obesity is one of the major risk factors for heart disease and diabetes. Making healthier food choices will help take off the extra pounds and keep them off. Eat fewer calories, read those labels, and pay attention to the suggested serving sizes. In other words, eat smaller portions. Listen to your body and eat only when you're hungry, not because you're tired, stressed, or bored. And avoid fad diets. They may take the weight off faster, but you'll likely gain it back. This brings us to a risk factor of premium importance when you're trying to get back to cardiovascular health: physical inactivity. You've got to get moving. Regular exercise can help you control your weight and other risk factors such as diabetes, blood pressure, and cholesterol. You'll find an exercise exertion scale in your Take the Journey booklet. The ideal range is 11 to 13, or light to somewhat hard.
There are a couple ways to tell if you're exercising correctly. One of my favorites is the talk or sing test. If you're exercising and cannot carry on a conversation with your friend, you probably need to slow down.
Oh, beautiful for spacious skies for...
However, if you can sing America the Beautiful with no problem, you need to pick up the pace.
Check with your physician before starting an exercise program. Some of you will have been prescribed cardiac rehab, which is a complete program of exercise instruction and health education. But exercise is for everyone and should include cardiovascular and pulmonary fitness, flexibility, muscular endurance, and muscular strength. Exercise pays off in dozens of healthy ways. Some stress is good. It can energize you and help you focus. Too much can harm your heart. To manage stress, exercise 3 to 5 days a week. Take 5 minutes to breathe deeply. In for 3 seconds and out for 3 seconds. Get a good night's sleep. Your Take the Journey booklet has tips for better sleeping. Speak up. Let others know what you need. Try turning a negative outlook into a positive one. Just step back, take a deep breath, and give yourself a positive self-talk. It's important to note that anyone who has had a procedure may experience feelings of sadness. About 1 in 5 people do. Generally, with a little time, feelings of sadness pass. But if you feel very sad or discouraged for more than a couple of weeks, call your physician or another qualified professional. Counseling or medication can help you cope with the sudden changes in your life. As you care for your physical health, remember to pay attention to your emotional health too. Call your physician or call 911 immediately if you have thoughts of harming yourself. No matter how old you are, it's never too late to quit smoking. Did you know that once you quit smoking, regardless of your age, your risk of cardiovascular disease drops by 50%? You also reduce your risk of cancer and lung disease. It may not be easy, but smoking is a risk factor you can control. If you need help, talk to your family and friends and let them know you plan to quit. Ask your physician about medications that might help. Prescribed medications combined with nicotine replacement therapy have proven to be effective. Chew sugarless gum. Join a support group. And consider moving social gatherings to environments that don't encourage smoking. If you're thinking about replacing cigarettes with smokeless tobacco products or cigars, think again. They're no better than cigarettes. Cut out tobacco completely. Your family and others will benefit too, as they no longer breathe your secondhand smoke. If you have diabetes, it's critical to monitor blood sugar daily. Your physician or another healthcare professional can show you how and when to check it. It's also good to make an appointment for a hemoglobin A1C test at least twice a year. This will show your average blood sugar levels for the past 2 or 3 months. In other words, it will tell you if your treatment plan is working long-term. In general, the goal is to have an A1C of less than 7%. That's an average daily blood sugar level of about 155. In addition, your glucose targets should be less than 130 milligrams per deciliter before meals and less than 180 milligrams per deciliter after meals. There's more information in your Take the Journey booklet, including an exam and test checklist that tells you what checkups you may need and when. A diagnosis of heart failure may sound frightening. Heart failure, however, does not mean your heart has stopped working. It means it's not pumping as well as it should. And as a result, your heart, organs, and tissues may not be receiving enough blood and oxygen. Even if your heart failure can't be cured, it can be treated, and the symptoms can be managed. Let's examine the symptoms. Shortness of breath, swelling of the hands, feet, or a decrease in tolerance for activity, weight gain, and finally, a productive cough. Treatment